Hi, my name is Ross Hauser. I'm Medical Director of Caring Medical and Rehabilitation Services in Oak Park, Illinois. The video you're about to see is me actually training somebody here at Caring Medical to do Hackett-Hemwall prolotherapy. We consider Hackett-Hemwall prolotherapy to be comprehensive. By comprehensive, we mean that all the pain-producing structures are treated. For instance, if somebody has a meniscal tear, when they got the meniscal tear, they also probably injured the ligaments. And that's what's causing the joint instability. To totally cure a person of chronic pain, mostly what's needed is the joint to become stable. And the only way that can be done is if the person comprehensively treats the joint, especially the ligaments. And to do that, you need to receive comprehensive Hackett-Hemwall prolotherapy. Prolotherapy, to become somebody who's proficient at prolotherapy, it takes hands-on training. So I hope that you'll enjoy this video showing me training somebody in comprehensive Hackett-Hemwall prolotherapy.
Hand problems are ubiquitous across the country. We're all using our hands so much more than we used to, especially with computer work and cell phone work, and almost everybody uses their hands in their job. I especially do as a prolotherapy doctor. I mean, my right thumb is like 50% bigger than my left thumb, and I have humongous calluses in different fingers, my injection fingers. Here you can see me in the yellow. That's how you can almost always recognize me, Dr. Ross Hauser. I'm holding someone's hand as I have a student in the office learning prolotherapy. At first, when we're doing the hand and the fingers, we often start with the thumb, as that's the most severely involved joint often. The thumb, we have opposable thumbs as human beings. See how here I'm showing the student how to inject the base of the thumb. But the thumb, base of the thumb, the basilar joint of the thumb where this student is injecting right now, that's the joint that's most commonly affected in the hand. So thumb arthritis and degenerative arthritis of the fingers responds great to prolotherapy. You know somebody has degenerative arthritis of the fingers when they have little nodules on the fingers. They're called Bouchard's and Heberden nodules. Those nodules form to try to stabilize the joint. Well, why does the joint become unstable? Because the person had a ligament injury in the joint. So you can see here the person has some joints that look bigger than other joints. Here the student's injecting the metacarpophalangeal joint. Then she'll go up to the PIP joint, or the proximal interphalangeal joint, specifically going into the joint and injecting the collateral ligaments on the side of the joint. And you can see also you can do all the finger joints as well as the thumb joint, in just a few minutes. So it is a painful injections, but we do use a anesthetic cream on the skin that does block a lot of the pain. And this person doesn't have any medications on board, and you could see that they're not jumping or anything. The student is doing a great job as far as hitting the bone with each of the injections, and you can see how comprehensive this treatment is. And that's really what people need, is comprehensive Hackett-Hemwall prolotherapy.